Hey everyone, you ever get that nervous feeling, when you're about to open a medical bill?
Oh, yeah.
Well, imagine opening your medical record and finding a mistake, even scarier, right?
Oh, for sure.
The thing is, it's more common than you would think.
Really?
Yeah. So in this deep dive, we're going to unpack some brand new research about a project called MEDEC,
Okay,
which stands for Medical Error Detection and Correction.
gotcha.
And get this, the paper was just published on January 3rd, 2025.
Fresh off the press. What makes this so fascinating is that we're not just talking about typos.
Right.
This research explores how researchers are training AI to find and fix serious errors in clinical notes,
Yeah.
those detailed records doctors take about your symptoms, diagnosis, and treatment.
Okay, so why should we care about errors in these notes?
Well, this research found that 1 in 5 patients actually spot mistakes in their records,
Wow.
and a whopping 40% of them considered those errors to be serious.
So not just a misspelled word,
No.
but potentially the wrong diagnosis or treatment plan.
Exactly, and that's where the potential of AI comes in.
Yeah.
We're seeing these large language models, or LLMs, being used more and more in medicine.
Hmm.
They can help generate clinical notes, answer medical questions, even mimic the way doctors think through a case.
I've heard about AI doing pretty well on some medical exams, like
Yeah.
actually beating the average human score. Are we talking about the same thing?
You are. They've tested LLMs on exams like the USMLE and even neurology board exams, and the results are pretty impressive.
Wow.
But there's a catch, and this is where things get really interesting.
Okay.
One of the biggest challenges with these LLMs is that they can sometimes hallucinate.
Wait, hold up. AI is hallucinating now.
Not in the literal sense, of course.
Okay.
In this context, it means that LLMs can make stuff up or present incorrect information as fact.
Mm.
And you can imagine why that's a big problem when it comes to something as important as healthcare.
No kidding. So how does this MDEC project fit into all of this?
MEDEC is designed to test just how good AI is at catching and correcting medical errors. They focused on 5 main types of errors, things like misdiagnoses, incorrect treatments, or even getting the cause of an illness wrong.
So it's like a medical error obstacle course for AI.
You could say that.
Right.
And to make this testing as realistic as possible, they used 2 very clever methods to create the MED dataset.
Okay.
First, they took real questions from medical board exams, the ones doctors have to pass to get licensed, and they added carefully designed errors into those questions.
So they're using the kinds of challenging scenarios doctors are actually testing on.
Exactly. And the second method involved taking real clinical notes from 3 different hospitals and having medical students introduce specific types of errors.
Clever. A mix of simulated scenarios and real-world examples.
Yeah.
Sounds like a really thorough way to test these AIs.
Mm-hmm.
So what kinds of AI did they use?
They threw a whole range of LLMs into the mix.
Yeah.
Different sizes, different developers, some from Google, some from OpenAI, even one from Anthropic. They even included a small language model called Phi-37B just to see how it would stack up against the big guys.
Okay, now I'm really curious.
Yeah.
How did these AI contestants do in this medical error face-off?
Well, before we jump into the results, let's break down the tasks these LLMs had to tackle.
Okay.
They were given 3 main challenges. First, they had to simply detect whether or not a given text contained an error, a basic yes or no.
Seems straightforward enough. What about challenge number 2?
The second task was to identify the specific sentence where the error occurred, assuming they found one in the first place.
Okay, getting trickier. And the final challenge.
The third task was the toughest of all.
Okay.
If they found an error, they had to actually generate a corrected version of that sentence.
So not just identifying the problem, but actually trying to fix it.
Precisely.
Interesting.
And that's where it gets really interesting because to judge their performance, the researchers used a bunch of different metrics.
Okay.
They looked at accuracy, of course, but they also assessed how well the generated corrections matched the intended corrections.
All right, spill the tea. Who came out on top? Were any of the LLMs able to impress?
Some of them did. When it came to just detecting if an error was present, Claude 3.5 Sonnet took the lead with a 70.16% accuracy rate.
Claude 3.5 Sonnet.
Yeah.
I'm filing that name away. Any other strong contenders in the error detection category?
The O1 mini model wasn't far behind, clocking in at 69.08% accuracy.
Okay.
But when it came to actually fixing those errors, O1 Preview stole the show.
It did, yeah.
So O1 Preview was the correction champion.
Mm-hmm.
What does that tell us? Were some types of errors easier for these AI models to spot than others?
That's a great question. It seems like causal organism errors, which involve identifying the cause of an illness, were generally easier for the AIs to detect across the board.
Okay.
But remember, we're not just comparing AI to AI here.
Right.
The researchers also had 2 human doctors complete these same tasks to see how they measured up. Okay, now this is where it gets really interesting. How did the human doctors do? Did they blow the AI out of the water?
They certainly held their own. Dr. #1 had a 79.61% accuracy rate in detecting errors,
Oh, okay.
while Dr. #2 came in at 71.61%.
So both higher than any of the LLMs.
Exactly.
So even with all their fancy algorithms, the AI couldn't quite outsmart human doctors when it came to spotting those errors?
Yeah.
But I'm guessing the story's not that simple.
It never is.
Okay.
Remember, these were very specific tasks, and the field of AI is constantly evolving.
Yeah.
Plus, those overall scores don't tell the whole story.
Right.
Let's look at some specific examples from the research to see where things get really nuanced.
Okay. Give me a case.
All right, imagine this. A 23-year-old man suddenly collapses while playing baseball.
Definitely. What happened?
Well, according to the clinical note, after regaining consciousness, he's diagnosed with aortic stenosis.
Aortic stenosis. That sounds serious.
It is. It means the aortic valve in the heart is narrowed, restricting blood flow. But here's the thing.
Yeah.
Both human doctors, as well as most of the LLMs, flagged this diagnosis as incorrect.
Oh, wow.
They picked up on clues in the case that actually pointed to hypertrophic cardiomyopathy.
Okay. Break that down for me. What is hypertrophic cardiomyopathy?
Essentially, it means the heart muscle has become abnormally thick, which makes it harder for the heart to pump blood effectively.
Got it.
And this is a great example of how these AI systems can actually analyze medical text and use that information to potentially arrive at a more accurate diagnosis.
So both the AI and the doctors were on the same page for that one?
Pretty much, yes.
Okay.
But the way they got there was interesting.
Okay.
One of the LLM models, Claude 3.5 Sonnet, actually gave this long, detailed explanation of why aortic stenosis was the wrong diagnosis
Uh-huh.
and why hypertrophic cardiomyopathy was a better fit.
Interesting.
It even cited specific details from the case, like the presence of something called a double apical impulse.
Wow. It's not just saying this is wrong. It's trying to think like a doctor and explain its reasoning.
Exactly. And that raises some really interesting questions about how we evaluate these systems.
Yeah.
Do we just care about the final answer? Or is the reasoning process just as important?
That's a great point. It's like when you're grading a student's exam, sometimes how they got to the answer is just as important as the answer itself.
Right.
All right. What other cases did they look at?
Let's look at one that deals with a 4-year-old boy with a history of recurring bacterial infections.
Ah, that's rough. What's going on with him?
The note mentions that his maternal uncles actually died after experiencing similar issues.
Oh, wow.
Based on his symptoms and family history, he's initially diagnosed with common variable immunodeficiency.
Okay, so his immune system isn't working properly.
That's the gist of it.
Okay.
But here's the catch. Both human doctors and most of the LLMs flagged this diagnosis as incorrect.
Really?
They pointed to either Bruton agamoglobulinemia
Okay.
or X-linked agamoglobulinemia as a more accurate diagnosis.
Hold on. 2 different diagnoses. I thought we were looking for one right answer.
And that's what makes this example so fascinating.
Okay.
It turns out Bruton agamoglobulinemia and X-linked agamoglobulinemia are actually synonyms for the same rare genetic disorder.
Ah, okay. So they're both technically correct.
Exactly. It highlights how complex medical terminology can be.
Right.
And how there are often multiple ways to describe the same condition.
That makes sense.
Yeah.
But it must be even harder to judge these AI systems if there isn't always a single right answer.
Absolutely. It really challenges those traditional evaluation metrics that rely on finding an exact word match.
Right.
Even if the LLMs didn't use the exact same wording as the reference answer,
Hmm.
they still managed to show a really deep understanding of the medical concepts at play.
So they were connecting the dots, just like a doctor would, taking the symptoms, family history, and lab results into account to arrive at a specific and accurate diagnosis.
Precisely.
Okay.
Now, remember how I mentioned that the human doctors didn't always agree with each other?
Yeah.
This case is a perfect example of that.
Okay.
While both doctors correctly identified the error, they phrased their corrections slightly differently.
Mhm.
One just stated the diagnosis, while the other added some context and differential diagnosis information.
So even among experienced doctors, there can be variations in how they approach and document medical cases.
Absolutely. And that adds another layer of complexity to the challenge of training AI to work in this nuanced world of medicine.
Yeah.
It's not always as black and white as we might think.
So it's not just about teaching AI to spit out the right answer. It's about teaching it to think critically and adapt to different situations, just like a human doctor would.
You got it.
Okay, you mentioned one more example. What have we got?
This one shifts gears a bit.
Okay.
The error isn't about the diagnosis itself, but about how the patient's condition is managed.
Okay.
We're looking at a 50-year-old woman with a bunch of symptoms, including weakness, lightheadedness, and epigastric pain.
Sounds like she's not feeling too great.
Not at all.
Okay.
The note details her medical history, including a previous abnormal pap smear. Thankfully, the follow-up biopsy came back negative for malignancy.
That's a relief. So what's the error here?
The note ends by saying that a fecal occult blood test is ordered.
That's the test that checks for hidden blood in the stool, right?
Yeah,
Often used for colon cancer screening.
exactly. But here's where things get interesting.
Okay.
The human doctors and the AI systems actually disagreed on whether this was an error.
The split decision. Okay, tell me more.
One of the human doctors and some of the LLMs, like GPT-4 and its variations, said the text was correct. They didn't see a problem with ordering that test.
But the other doctor disagreed.
They did, and they were joined by several of the other LLMs, including O1 Mini, O1 Preview, and Claude 3.5 Sonnet.
Interesting. What was their reasoning?
The doctor who flagged this as an error pointed out that the patient hadn't had any follow-up after her cervical biopsy. They felt that HPV testing should have been prioritized over the fecal occult blood test.
So it comes down to a difference in priorities when it comes to ordering tests. It highlights that the concept of a medical error isn't always clear-cut.
Right.
Different doctors might have different approaches based on their experience and judgment.
Exactly. And this example really shows how those different perspectives can play out even when we're talking about AI.
Okay.
Some flagged the text as an error, while others didn't.
It's a reminder that even in the age of increasingly sophisticated AI, that human element, with all its nuances, still plays a vital role in healthcare.
Well said.
Okay.
But before we wrap up our analysis, there are a few other things we should touch on.
Yeah, a few more things, yeah.
So we've seen AI go head-to-head with human doctors in this medical error detection challenge, but at the end of the day, who really came out on top?
Well, if we just look at the scores, human doctors did edge out the AI systems in terms of accuracy.
Okay.
Both for detecting errors and for pinpointing the sentence containing the error.
But like when we're talking about, those scores don't tell the whole story, right? Exactly. Some of those LLMs, especially that O1 preview model, were really impressive, not just in detecting errors, but in actually generating corrections that were both accurate and nuanced.
It's like they were learning to think like doctors,
Yeah.
weighing different factors and considering multiple possibilities, not just spitting out a single right answer.
That's a great way to put it. Yeah, the researchers actually suggested a few possible reasons why the LLMs didn't completely outperform the human doctors.
Okay.
One idea is that the specific tasks in this study, those error detection and correction challenges, are probably relatively rare in the massive data sets that these LLMs are trained on.
So they might be amazing at generating text, answering your questions, even writing poetry.
Right?
But when it comes to this very specific skill of spotting and fixing medical errors,
Yeah.
they haven't had as much practice.
That's the thinking, yeah. And the researchers also pointed out that it's probably inherently harder to analyze and fix existing text
Yeah.
than it is to generate something from scratch. It's like the difference between editing someone else's essay and writing your own.
That makes sense. Editing often requires a deeper level of critical thinking and understanding of those subtle nuances of language.
Exactly. And when you're dealing with medical language, those nuances can be even more crucial.
So what does all of this mean for the future of AI in healthcare? Is it going to replace doctors?
It's clear that AI has huge potential to be a powerful tool in healthcare. But the goal isn't to replace doctors, it's to support them,
Okay.
to augment their abilities and ultimately improve patient care.
Right.
Imagine a world where AI acts as a safety net, helping doctors catch those potential errors and ensuring patients get the best possible treatment.
That sounds like a future I could get behind, but it's not something that's going to happen automatically, right?
You got it. It's going to take a lot of careful work,
Okay.
ongoing research, thoughtful implementation, and real collaboration between AI experts, doctors, and patients.
So it's not just about building smarter AI, it's about building trust and making sure these technologies are used responsibly.
Couldn't have said it better myself. This deep dive into the MEDEC project has given us a glimpse into those exciting possibilities and also the potential challenges of bringing AI into healthcare.
And for those of you listening who want to explore this further, we'll have links to the full research paper and the MEDEC dataset in the episode notes. Definitely worth checking out.
It is, because this is really just the beginning of the story. The future of AI and healthcare is unfolding right before our eyes, and it has the potential to transform medicine as we know it.
And that's what makes these deep dives so fascinating. We get to explore the cutting edge of knowledge and grapple with the big questions that are going to shape our world. Thanks for joining us on this deep dive into AI and healthcare.
Until next time, keep learning, keep questioning, and keep an open mind.